Between 1800 and 1850, Canada experienced major social and economic changes that reshaped communities and industries. These changes were driven by immigration, new markets, transportation developments, and public health challenges. One of the biggest changes was increasing immigration. Thousands of people, especially from Ireland, came to Canada, fleeing poverty, political unrest, and the Irish potato famine of the 1840s. Many immigrants faced difficult conditions, including overcrowding, disease, and discrimination. However, they also contributed to Canada's growing workforce, especially in farming, construction, and industry. At the same time, Canada's economy was shifting. The global recession of the 1830s affected trade, but new markets for lumber and wheat emerged. The demand for timber led to a booming logging industry, particularly in New Brunswick, Quebec, and Ontario. Wheat farming also expanded, as Canada became an important supplier of grain to Britain. These industries created jobs, but also led to environmental changes, as forests were cleared for timber and farmland. Transportation improvements played a key role in economic growth. The construction of canals, such as the Rideau Canal and the Welland Canal, allowed goods to be transported more efficiently. Railways were also being developed, improving travel and trade. These projects provided jobs for thousands of workers, including many Irish immigrants. Education also saw reforms during this period. Laws like the Common School Act of 1846 helped expand access to public education, though not everyone had equal opportunities. Many Indigenous and lower-income families still struggled to send their children to school. Public health was another major concern. Cholera and smallpox epidemics swept through Canada, especially in port cities where new immigrants arrived. Poor sanitation and overcrowded living conditions made diseases spread rapidly. In response, early public health measures, including quarantine stations, were established. These social and economic changes had lasting effects on Canada. Immigration shaped the country's diverse population, new industries strengthened the economy, and public health efforts laid the foundation for modern medical practices. However, many groups, including Indigenous peoples, faced ongoing challenges, as their lands and ways of life were impacted by these developments.